In fact, I remember very clearly thinking to myself, I don't know how I will ever overcome some of these challenges I'm facing. But I didn't even mention I also struggled with a very strange type of obsessive compulsive disorder that most people probably wouldn't even understand is a type of OCD where, believe it or not, for about 2, 3 years of my life, obsessed about my sexuality. And what that would look like is I couldn't go through a social interaction without trying to assess my sexual attraction to someone. Was it there? Was it not there? How does this fit with my identity of sexuality? And I understood also eventually through this work where that came from. There were roots of trauma on that side of things for me. And I was able to help move myself through all of that stuff. And then naturally, these kind of symptoms and conditions just sort of slip away when you do the work and the healing. They just, it's, I remember always being told OCD is just something you're going to have to manage for the rest of your life. It's not something you overcome, and I can say I've overcome it. So it's an
You can
interesting
absolutely overcome
dynamic.
it. That's the worst. I know that, and that's not weird. I've actually experienced quite a few people y- similar along some
Yeah,
lines. Their sexual trauma. You can obsess and have compulsive behaviors over anything, so it
all sorts of things.
makes sense to
Yeah.
manifest that way for sure.
OCD just tends to very much get fixated on like the orderliness stuff, which isn't even OCD in most people's descriptions, or like
It's
the
just the
germ
topical.
and sanitation
Yeah,
type stuff. Yeah, it's
exactly.
like
Yeah,
people think of the external compulsive acts to try to subdue the symptom, but like there can be a whole mental loop
oh,
where it doesn't even go external. And I lived
correct.
that world for many, many years, and it's not a
Yeah.
comfortable experience.
It's not, and it's also pretty scary because no one around you really even knows. Because if someone's doing like, I have to touch the doorknob 100 times, like you can see that and go, oh, you need help. If it's happening internally, you think you're crazy, and nobody knows that you're doing that. A lot of times it gets confused for like ADHD because like, you have no attention because you're ruminating and doing the obsessive things in your head rather than externally. So it gets misdiagnosis as that or like a tick or something.
Yeah.
It's a
And it
fascinating.
often involves a very taboo type of subject. Like in my case, I felt very uncomfortable bringing this to the surface. Eventually, there were a few people I learned to talk about it with. But I also remember going to a support group at one time, and there was a woman there I remember who had like 2 or 3 kids, and her OCD was about whether or not she was a pedophile. Because if she would just like look at her kid in a way, or like,
Right.
give them
Yeah.
math, like start questioning if there was
Yes.
something malicious going on in this process. Like, how do you talk to people about that? That you're having thoughts about whether or not you're a pedophile to your child. Like, for most people are going to beg the question of like, well, why are you thinking that way? Like, it doesn't really get handled in a very nuanced way in
No,
most
doesn't.
scenarios, and that. And so it just makes it very tough to speak about. And I can only imagine what a woman who's going through that kind of experience is going through.
That's very painful. Yeah, it gets sort of delusional at some point because you start like gaslighting yourself basically. And of course you're not a pedophile, and like the pedophile is never going to go to therapy and ask, am I a pedophile? They're just going to struggle with it and like not do anything about it. If you're saying
Yeah.
something, it's probably OCD or something similar. You can obsess over anything and have worry about the weirdest stuff with OCD. It's just anxiety off the rails. I mean, it's on that whole
Yeah.
anxiety spectrum. It's cool to
Yeah.
hear that psilocybin can work with that. And then the whole field of psychedelic assisted psychotherapy is coming, which is cool. I'd imagine you've done a little bit of that while working through your own stuff with someone who can help you. And that's probably what you do at your
Yeah.
retreats, I would imagine. That's the kind of the point.
Yeah. And that's kind of how the journey just became deeper and deeper.